Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Hello, everyone, and welcome to 5 to Thrive Live. I'm Karolyn Gazella, and I co-host this show with my good friend, Dr. Lise Alschuler. Today, we will be talking about Cancer Treatment-Induced Accelerated Aging, or TIAA. And I must admit, I had not heard about TIAA, although, it seems logical that cancer treatments may increase the risk of accelerated aging, given the way that they work in the body. But I'm interested to learn more. And fortunately, I have the perfect expert to discuss this topic. With me is Dr. Nathan Handley, who is the director of the Integrative Cancer Recovery Program at the Marcus Institute of Integrative Health at Jefferson Health in Pennsylvania, where he is also an assistant professor in the Department of Integrative Medicine and Nutritional Sciences. But before we dive in, I'd like to thank our sponsors, beginning with Cetria, a patented form of glutathione clinically proven to raise blood glutathione levels. Glutathione is the master antioxidant and the body's primary defense against free radicals. It also helps support respiratory health. For more information, visit cetriaglutathione.com. Also, Pro Thrivers Wellness Brain, a product specifically for thrivers that contains cognizin for memory, focus, and attention, as well as other brain-supporting nutrients and herbs. You can find Pro Thrivers Wellness Brain online at pureformulas.com. There's also Pro Thrivers Wellness Sleep, which combines higher dose melatonin and other sleep-supporting natural ingredients specifically designed for thrivers. And Pro Thrivers Wellness Sleep is also at pureformulas.com. And Dr. Ohhira's Probiotics, it's a best-selling probiotic for more than 30 years, and it contains 12 probiotic strains that are shelf-stable, so no refrigeration is required because of a unique 3-year fermentation process. It's a very effective probiotic. Learn more at drohhiraprobiotics.com. Dr. Handley, thanks again for being back on the show.
Yeah, thanks. I'm really excited to be back again.
And actually, on our last show, this topic came up, and that's why I wanted to have you on, because I have to tell you, this is fascinating, scary, and concerning, all in the same breath. So, what is treatment-induced accelerated aging, or TIAA?
Yeah, well, I think we've probably all seen this, but if you imagine yourself in clinic and seeing a patient who has been treated for cancer, and I see this all the time, say like a young woman in her 40s who's treated for breast cancer, and she gets chemo, maybe she gets immunotherapy as part of the regimen, and like over the course of months, like she just starts feeling more and more tired, more and more fatigued. Maybe, different abnormalities start popping up. Maybe her thyroid gets sluggish. Maybe she gets some liver inflammation. And, she ends up having surgery and radiation. And at the end of the journey, she may be declared cancer-free, but like she doesn't feel great. She feels, like totally drained. And like the quote that always gets me, like this is the line that I hear all the time is, I feel like I've aged 10 years since I started treatment. And that 10 years might have happened over the course of just a few months. And, like people have so much wisdom in their bodies, and that perception that they've aged that length actually has real biologic and physiologic merit. And so that is what TIAA is. It is treatment-induced accelerated aging, is the measurable biological acceleration of the aging process caused by cancer treatment. And it's not just a metaphor. This is something that is like well characterized and well defined at this point. And the mechanism essentially is that cancer treatment does activate many of the same molecular pathways that drive normal aging, but this aging happens in kind of a compressed period of time. And if you think about kind of the mechanism of how many of our cancer treatments work, especially some of the older ones, like old-fashioned chemotherapy works by just basically being toxic to cells. It is we call it cytotoxic chemotherapy. And it causes all this oxidative stress. And specifically, there are a couple, key mechanisms that drive this. One is cellular senescence, which is basically this scenario in which cells become damaged by chemotherapy, but they don't necessarily die. They turn into, sometimes they're called zombie cells, where they're kind of like, in this twilight zone, where they're not kind of like providing a lot of beneficial biological function, but they are secreting inflammatory signals. There's something called a senescence-associated secretory phenotype, which is just a bunch of proteins and molecules that these cells secrete that can then harm surrounding tissue. So they're called zombie cells because they actually can like turn other cells into senescent cells as well. So that's one mechanism. Another mechanism is you can get shortening of the telomeres in cells. So telomeres are kind of like the little caps on the ends of DNA that have been associated with kind of longevity. And as you age, telomeres tend to shorten. Chronic inflammation is another big driver, which is part of the senescence picture. And then, another piece is that there's this what's called epigenetic age acceleration, where the patterns of molecules on DNA can change. And so we call these methylation patterns. And it's not necessarily change to the DNA sequence itself, but to how the sequence is being kind of read by the body. And the result of all this, basically, the results are the symptoms that person who comes into clinic presents with. And so it's like fatigue, chemo brain, frailty, osteoporosis, heart disease is a big one. Some of these things that are like sometimes feel kind of like ambiguous, but are very real. Like this constellation of symptoms, that is TIAA. And I think it's really important because it is, it's something that really, I think, unifies survivorship care, because it's something that is seen as a consequence of many different types of treatment.
Yes, and you mentioned chemotherapy and immunotherapy. I'm assuming radiation can be thrown in there, and really any form of cancer treatment can be a part of that constellation.
Yep, definitely. So you can see it with radiation. You can see it with hormone-directed therapy, like aromatase inhibitors and tamoxifen. Mm-hmm. And so, yeah, pretty much any cancer-directed therapy, you can have those consequences.
Yeah, and I'm glad that you mentioned that this is measurable. It's been researched, because that was kind of surprising to me. After you mentioned it on the show, I dug in, and mm-hmm. I was really impressed by the amount of information that is out there. But I have to say, this is a little hard to take. Survivors are already worrying about cancer recurrence, and now they have they're worried about accelerated aging. So it's tough. So how big of a concern is it? Do we know how common it is among cancer survivors?
Yeah, that's a good question. And I would say, the extent to which it happens is to some degree universal for someone who's, especially for kind of systemic therapy like chemotherapy or radiation. The degree varies, but the biology is always happening in those scenarios. Mm-hmm. But, it does vary a lot. And so, there's some interesting data that some of the more intensive chemotherapy regimens, like anthracycline-based regimens. So anthracyclines are like adriamycin, or also doxorubicin is the generic name for it. That's the one that people sometimes call the red devil, used in a lot of breast cancer regimens. there is data to suggest that can accelerate biological age by 23 to 26 years within kind of 12 months of treatment.
Mm.
And that can be measured by kind of some specific protein expression. And there are a lot of different ways to measure it, but it's certainly much less for other regimens. So like a non-anthracycline regimen might be like 10 years. And other things, like a targeted therapy or something like that, maybe a shorter than that. And then the extent to which it happens in one person versus another person varies a lot. But like a young adult cancer survivor who is frail, in some cases they've seen, changes in this expression that's equivalent to 35 years of biological aging. And so it is very common. And I think, it's relevant because if you look at cancer survivors, the leading cause of death in that population actually is cardiovascular disease, more so than cancer recurrence. Mm-hmm. And, a lot of that cardiovascular disease is kind of a direct result of this TIAA process.
Mm-hmm. Yeah. So before we get into the practical strategies, what concerns you the most when it comes to addressing TIAA with your patients?
I think this is one of the major gaps that exists in the cancer treatment paradigm right now, I think. And it's not because people aren't paying attention to it. I think it's just there's been so much focus on curing the cancer historically that there has been less of an effort focused on kind of extended survivorship care. And the result is that like the clinical system isn't really built to evaluate TIAA and other needs that arrive in survivorship, because the standard follow-up is really kind of focused on recurrence surveillance and not necessarily on like cancer treatment effects or aging assessment. And so mm-hmm. patients don't know what's happening. They might end up blaming themselves for fatigue or cognitive, brain fog, or, sometimes they might feel gaslit if they have these symptoms. And, like, I don't think this always happens, but I've certainly heard scenarios where people kind of report these symptoms and then are just told like, well, you should just be grateful, that you have had this great cancer treatment. Mm-hmm. I think certainly like everyone in the healthcare system wants to help, but I think we're not as well equipped to provide that help right now. Right. And so, what concerns me the most is that we know this is happening and we're not necessarily applying the tools to assess it and treat it.
Yeah. And I'm thinking that integrative oncology, which is your specialty, this is kind of a place where it could shine. So let's talk about good strategies. And I want to first talk about reducing the risk of TIAA. I mean, is that even possible? I mean, can we at least reduce the risk if we know we're going into a treatment regimen? Are there things that we can do?
Yeah, there's definitely things that we can do. And, the good news is, in some ways, like TIAA maybe is the push we need to realize that like this is we've always been talking about this. We just didn't have the name TIAA. And so, a lot of the strategies that we use to kind of improve outcomes in cancer are things like prehabilitation, where someone's doing like robust exercise and diet protocols before surgery or before treatment. Those things matter a lot. And so, let me give you some specific examples of what this might look like. I think maybe one of the most compelling examples, the foundation of an integrative oncology approach to care, and kind of more broadly an integrative medicine approach to care, has to do with diet and lifestyle. And so like that's true for TIAA prevention and reduction as well. And so, perhaps the most compelling recent example of that is is a study that came out in the New England Journal about a year ago that showed that exercise during treatment significantly improved both disease-free and overall survival for patients with colon cancer who had treatment. And so now this is listed, exercise is listed as like a category 1, very high evidence intervention to help kind of improve outcomes for cancer. And the mechanism is, at least in part, because it attenuates biological age acceleration. And so we've actually seen that aerobic exercise can reset some of the methylation patterns or some of the aging patterns that you see in skeletal muscles. And there's data that even 5 months of training can reverse these changes back towards healthy patterns, even 10 plus years after treatment. So it's, those foundational things are relevant before treatment and they're relevant after treatment. We know that Mediterranean diet can significantly lower risk of premature aging. And there's the data that we are using to kind of evaluate that is mostly in childhood cancer survivors. And so there's this fairly large cohort called the St. Jude Lifetime Cohort. That's a few thousand patients. And they found that, dietary factors can attenuate the risk of aging, even if you're controlling for, treatment type and treatment duration and that kind of thing. And then, other foundational things that we talk about, like sleep quality and physiologic and psychological stress, those are both independently associated with epigenetic, with accelerated aging as well. And so, we talk about like sleep and stress, and sometimes that feels kind of soft, but there's real biology there. And so, as it turns out, many of the interventions that we think about in the integrative world, like these are relevant for TIAA. It's just another way of thinking about what we're trying to do with our treatments.
Right. I want to go into these in a little bit more detail, but the other big question is, these diet and lifestyle strategies will help reduce the risk. Will they also help address it after treatment is done? Like, can we incorporate these strategies to reverse TIAA?
Mm-hmm. Yeah, another good question. And I think the answer there also appears to be yes. And so, if we think about, for example, the study, the challenge trial in the New England Journal from 2025, that study that was looking at the impact of exercise, that was in cancer survivors. And so it was specifically, the study looked at patients who had completed chemotherapy for colon cancer. It was, I think, stage 1 to stage 3 was the population they looked at. And so they had already, the chemo was said and done. And then what the study did is it randomized the two groups. And one of the groups basically got usual care, which was, do some diet and exercise and like live a healthy lifestyle. The typical fairly generic recommendation. And then the other cohort, the other arm, got much more specific guidance. And the guidance was essentially, it was a structured exercise plan, but it aligned with the guidelines for the American College of Sports Medicine and NCCN and some of these other organizations. And what they found is that, and so what that was 150 plus minutes of aerobic activity per week, 2 to 3 sessions per week of resistance training. And so there was this aerobic piece to it, but there was also this, strength component to it. And so it was not only cardiovascular fitness, but also muscular fitness. And after 5 years, what they found was that the disease-free survival and the overall survival was 30% better in the intervention arm compared to the non-intervention arm. And so this wasn't specifically, they didn't talk about TIAA, but you could frame it in that way. You can frame it as saying like, yeah, like we know that these physiological changes that were being produced by like the lifestyle intervention, they were really pulling some of the levers that we know are super relevant for TIAA. And so, like, was it a total reversal? Was it an attenuation, like a decrease in the aging? That I don't know. I don't think they looked at that specifically. But, there have been other studies that have definitely shown that, some of these interventions like, exercise, like various exercise interventions can really, can reverse some of the like epigenetic changes that you see.
Yeah, it makes total sense. Lisa and I have been talking about epigenetic influences for 20 years now. And
Mm,
the example I like to use is I am BRCA positive,
mm,
and my family has been studied. And um, the research shows that even if you're BRCA positive and you maintain a healthy body weight, you have the Mediterranean diet, and you exercise, you shore up the other cell repair genes,
mm.
and you reduce your risk of breast or ovarian cancer epigenetically. So I think that's a pretty powerful example, and it kind of relates to what you're talking about. So I want to dig into two of the things you mentioned. We talk a lot about the Mediterranean diet, and we talk a lot about exercise,
Mhm.
but you as an integrative oncologist, when somebody is struggling with sleep,
Mm,
how do
mhm.
you help them? Because honestly, that is a biggie I mean, I've struggled with sleep
Yeah.
issues. I have friends, now that I'm in my 60s, it seems like it's even a little worse. So
Mhm.
what advice do you give for those patients?
Yeah. Yeah. I mean, sleep is such a common issue, and
Hmm.
so much of cellular repair and ultimately health arises with high quality sleep. And so, there's definitely a tiered approach. Like the foundational approach is good sleep hygiene. And so, we always start with that. And, like oftentimes that's something that people can say, like, yes, I'm doing that. Like
Hmm.
I'm, you know, sleeping in a dark room, a cool room, lights are off, there's not a TV in the bedroom. Like the bed should be used for sleep and sex, and not for like just hanging out. Um, you know, those are kind of important pieces of the equation.
Hmm.
Um, and but then it comes to like other types of interventions. And um, one of the most evidence-based interventions for kind of sleep disruption, it depends a little bit on what the underlying driver is, right? So if it's someone who is, being treated for breast cancer and now they have hot flashes all of a sudden, and the hot flashes are waking them up in the middle of the night, then you need to treat the hot flashes. And um, but if it's any of a number of things, sometimes the next step is, there's an intervention called CBTI, or cognitive behavioral therapy for insomnia. And this is like cognitive behavioral therapy, like a type of psychotherapy that has been really kind of strongly validated in the oncology population as one of the more powerful interventions to support sleep. And the
Hmm.
nice thing is that there are now apps available that can help people kind of walk through it. And a lot of it has to do with, there's a sleep training component of like going to bed and waking up at the same time. Um, but it also can help address, there can be a lot of anxiety that comes around sleep. And so actually um, one of the best apps out there to support it is freely available from the VA. Um, and it's called Insomnia Coach. And, so that's something that I often recommend for patients. And then there's, a bunch of different supplements and other therapies like that I might layer on depending on kind of what the specifics are. And so I like magnesium glycinate, or really low doses of melatonin, like physiologic doses of melatonin, like as low as zero point 0.3 milligrams. Sometimes glycine. I tend to be much more conservative with some of the therapies I use if someone's in active treatment, but um, theanine is something that I would sometimes add. And then, I'm always a big fan of acupuncture and kind of Chinese medicine as an additional layer that certainly has really good evidence, and I have personally found to be very helpful for a lot of my patients. So the good news is there's like a whole toolkit of things, and you can kind of do a layered approach and address each of them over time. And like I've definitely seen significant improvements at different levels of that approach.
Yeah, I would agree. I think that the take home message, because you just did identify numerous tools,
Mm,
numerous strategies, and there are a lot out there. One of the take home messages is don't suffer in silence.
definitely. Yeah.
Be proactive and look into these things. And I'm a big fan of magnesium glycinate and L-theanine
Mm,
and some of these others. Uh, but also, I do like your idea of, the insomnia coach and, just kind of changing routines.
mhm,
I think as it relates to sleep, and just as a recap, diet and lifestyle, where we want to be moving, we want to be. We talk about the Mediterranean diet because the research is so incredible. So we want to be eating a whole foods, healthy, colorful diet. We want to get enough sleep, and we want to manage our stress. So, yeah, I think that this is a tough topic, but I think you've given us a lot to think about. We've got about a minute left. Any
mm.
final words on this topic?
Well, I guess a couple of points. One is that as people have started thinking about TIAA more carefully and have started kind of constructing an idea of like what the best approach is, the best approach is really this like multi-targeted, multi-level intervention where you're addressing all of the variables that we're talking about.
Hmm.
A lot of it is lifestyle, but I think what's also exciting is that there is this new line of therapies. Um, there are two classes of medications called senolytics and xenomorphics, which are therapies that are basically designed to reverse the senescence process or kind of kill senescent cells. And some of these are natural products like quercetin, for example, or fisetin. And so there are some studies kind of underway right now looking at breast cancer survivors and frailer older survivals that suggest that there's early evidence that some of these therapies might help accelerate improvement, um,
Yeah.
post treatment.
Yeah, that's great. We'll have to have you back on to talk about some of those. It's a big topic, but unfortunately, we're out of time for tonight. But thanks again, Dr. Handley,
Yeah,
for joining me and talking about this important topic.
yeah, of course. Really happy to be able to share.
Absolutely. Well, once again, I'd also like to thank our sponsors, ProThrivers Wellness Sleep, ProThrivers Wellness Brain, Cetria Glutathione, the superior glutathione to support liver and immune health, and Dr. Ohhira's award-winning shelf-stable probiotic. Thanks for listening, and remember, you can find past shows at ithriveplan.com or wherever you listen to your favorite podcasts. May you experience joy, laughter, and love. It's time to thrive, everyone. Have a great night.